Hi, I'm Greg Kelly, and I'm here today with Nature's Root to reveal to you the creation of this new therapy, innervation point therapy. And we're here to talk a little bit about what that is and how you can use it in your practice to create a better experience for the clients on the table and allow them to walk away with a more sound understanding of what their body can do in order to heal itself. So what we're going to do is start with the feet, because as we all know, that's where the largest pores are in the body, which will allow for the maximum amount of absorption into the system through the blood, into the blood-brain barrier, which will allow it to be accessed bioavailably to the entire body. We're using 1 pump per foot, which is going to give us about 5 milligrams to enter into the system to start with. We're just putting the lotion onto the foot using some light massage techniques. If any trigger points are found, they can be assessed. But this is really just to get the CBD into the system so that the body can start responding correspondingly. Again, 1 pump, 5 milligrams of CBD. And the client always enjoys getting 2 foot massages. So there we go. Now we'll move on to the back. So to start with the back, we place a nice hot towel along the length of the spine in order to relax the client as well as open up the pores to create a better experience for the CBD to be soaked into the body. This can also be done on the feet as an optional treatment. After that has soaked in, we can then apply the CBD lotion, 2 pumps, 10 milligrams for the back. The beauty of this cream is that a little bit goes a long way. We don't want to overexcite these CB1 and CB2 receptors, and we don't want to supply them with more than they need, because then they will stop producing the cannabinoids that the system is already producing. So we apply the lotion, and then we begin to search the length of the spine where all of the nerves are exiting, to then go out and enter into the muscles and allow for us to have movement. And so once we find an area of tension, what we can then do is focus on that tension and create cross-fiber friction as well as holding trigger points. What this will do will allow for multiple amounts of hormones to be produced out of the pituitary gland, as well as provide a large amount of blood flow into the area where we're working. And what that blood flow is then going to do is pick up this CBD and carry it off throughout the rest of the system as we create circulation. So here we found a trigger point, levator scapula, right on the median angle of the scapula here. And what we're going to want to do is find the length of the fiber here. So that's at about a 45-degree angle. And we're going to want to cross fiber deep into that muscle tissue activating what are known as Pacinian corpuscles, which are part of the nervous system, which are going to send a signal to the brain that this area needs oxygenated blood. And it also allows for the system to focus on this point. And so once we feel the muscle releasing, we know that that CBD has been picked up and is now transferred throughout the rest of the body via the bloodstream. And so finding more trigger points in the shoulder blade here in infraspinatus. Constant hold will do the same thing as the cross-fiber frictioning, calling in blood flow and hormone release. (10 to 15 seconds). Release and soft strokes to smooth out. Continue your search, whatever you find, using the CBD as a guiding force, knowing that it's innervating and entering these muscles right where the nerves are, therefore being picked up by the information highway of the system, which are the nerves. And still using that same 10 milligrams that we started with. So that the client's body is able to absorb the CBD properly and not be overloaded. So again, we're working this cross-fiber friction pattern right on the attachment of the tendons running into the ischial tuberosity. And we're using that in order to stimulate the sciatic nerve and the femoral artery, which run parallel down the leg and create the information highway as well as the breath of the leg, the oxygen of the leg. And you also want to make sure that CBD gets worked up into the gluteus maximus and medius. And if trigger points are found, trigger points are assessed. (10 to 15 seconds) to decide the degree of the trigger point, and then depending on how intense the trigger is, anywhere from 30 seconds to 2 minutes can be required on a hold. And again, stimulating that blood flow down into the femoral artery and using that sciatic nerve innervation into the muscles of the gluteus maximus, medius, as well as the hamstrings. We create this CBD highway that allows for the body to integrate and absorb all of the nutrients and all of the benefits of the cannabinoid. Very important to get that cream into the back of the knee. Many absorption points here, pulse points, which are going to allow for that CBD to be picked up. And down into the calf. Where we work that into the gastrocnemius, opening the gastroc doors, and then accessing the soleus deep. Pressure is required but work within your client's comfort. And stimulating the Achilles tendon with friction. Causes blood flow and relaxes the retinaculum around the ankle and allows for the system, the cardiovascular system, to function properly, which is going to allow for more absorption into the body. Okay, so when we're working with the arm here, we're going to use one pump, 5 milligrams of CBD, and we're going to make sure that the majority of that CBD is centralized right into the armpit, right underneath the pectoralis major. That's where we'll find brachial plexus coming through, which is going to be our active nerve bundle that's going to come and service the arm. So we want to get that CBD nice and into that brachial plexus, where it's strongest and where it has the most nerves coming together. And then we can work that CBD down through brachial plexus into the bicep brachii. And down into the forearm, where we'll find the majority of our trigger points in the arm. So if need be on the arm, a half pump, another 2.5 milligrams of CBD can come through in order to complete the arm. And again, finding those trigger points, working cross-fiber friction, bringing in that blood flow, creating that nervous system response, exciting the nervous system to create an excitement in the CB1 receptors that are majorly found inside of the central nervous system. So working again with your client's comfort level, but working deep in order to access those trigger points. Stimulating the trigger point is the most vital portion of this massage, because that is what creates the response that allows for the CBD to be picked up into the body more readily. Working both sides of the forearm. And into the hand. Manipulating the metacarpals, in order to create space for all of those nerves that are functioning the fingers. And that's how you do the arm. Okay, again, so when working with the leg, modesty as well as accessibility are two of the most important parts of massaging with the leg. So we're going to have to be very precise with our draping again, because we're going to want to get up and access this inguinal region here. So we're really going to want to, again, get that nice and tucked underneath, almost creating like a diaper itself for the client. And get that tucked in as far as you can, creating a nice secure space here where nothing's coming loose and nothing is exposed. Again, with the legs, we're using 1.5 pumps, about 7.5 milligrams of CBD. And we're focusing most of that CBD up into the inguinal region and up into that quadricep attachment on the ASIS, the anterior superior iliac spine. And we're working those trigger points. We're working that attachment right there on the ASIS, right there on the pelvis. Creating the release in the pelvis, as well as a release of the hip. and the lower back, and getting that CBD into the body as fast and efficiently as possible. Working the entire quadricep, all the way from the knee up into the hip and across the adductors on the inside of the leg. Working as high as you can into the attachment, up into the tendon, releasing pressure the higher you get. Again, same amount that I started with is the amount that I'm using. No more is really necessary. But if you feel like you really do need more, another half pump to a pump can be added. Again, back of the kneecap, attachment to the kneecap, releasing both sides of the muscle so that the information as well as the nutrients can travel more efficiently through. Down into the shin. Innervations here come from L4, L5, so a lot of low back problems can be and will be assessed through the shin as a way to stimulate production of energy, blood flow, as well as movement of the tissue that surrounds the joint. Finding trigger points on tibialis anterior, cross fiber frictioning, hold, once you feel a release, you know the CBD is active in the system, and you can smooth it out throughout the chain. Into the ankle. Again, accessing that Achilles tendon. And working the top of the ankle, where all of those nerves, arteries, tendons, veins come together and get all tangled up. We want to loosen up and reposition all of that tissue so that the body can function the way that it's supposed to. Trying to loosen up the entire circuit, opening the circuit so that the electricity, quote unquote, can flow through more efficiently. So here we are back on the feet, half pump, 2.5 milligrams, all you'll need. Again, getting that lotion, that cream into the biggest pores in the body. It also is a great tool for anyone with plantar fasciitis due to the anti-inflammation properties of CBD. So it'll help to reduce the inflammation coming out of this Achilles tendon attachment here. It also creates some relief for what we call the stirrup of the foot, which is where the tibialis anterior comes and meets at the arch of the foot, and the peroneus longus comes and meets at the other side. We create this stirrup here, and a lot of tension is built up into the arch. And we can use the CBD to help to stimulate that release. And who doesn't love a foot massage? So now we're moving on to the neck. One pump, 5 milligrams of CBD. And we're going to work that in as close into the cervical vertebrae as we can. Trying to access all of those exit routes of the nerves. And then we want to be sure to get that CBD all the way up through the atlas axis. And some occipital ridge work is necessary to open up that canal so we can get that CBD all the way up into that atlas vertebrae. And then working fingertips down the spine in order to stimulate cellular reproduction and nervous functioning. And working the whole cervical vertebrae, all the way from 7 to 1. Bringing that CBD up closer and closer to the central nervous system to activate those receptors. And then we want to bring a half pump into the temporalis muscle to calm the nervous system, calm the client. And it's a main pulse point so we can get a lot of CBD directly into the central nervous system through the blood-brain barrier. That is our innovation point therapy, an endocannabinoid massage, brought to you by Nature's Root and me, Greg Kelly.